our virtual convention, the AAJA Fest. I'm Michelle Ye-Healy, the National President of AAJA. Obviously, this is not the convention we had originally planned for 2020, but I'm really excited to have this opportunity to reconnect with all of you, despite the distance. It's been a difficult year in so many ways. Our daily lives have been upended by the pandemic. Our AAPI community is still being targeted by racism because of the virus. Our journalists are being laid off and furloughed in this terrible economy, and our members are working tirelessly to push for systemic change in their newsrooms, along with our Black and Brown colleagues. Let's face it, it's been a hard year to be Asian, and it's been a hard year to be an Asian American, and a hard year to be an Asian American journalist. Which means more than ever, our AAJ community has needed each other. That's why we planned this virtual convention as a festival. Our schedule is packed with social events, in addition to all the trainings that we're offering. We want this space to be healing and comforting to all of you. And of course, we have karaoke tomorrow night. But please remember that as an attendee of an AAJ event, the AAJ Code of Conduct applies to you, both during the official programming and the unofficial events throughout the week. Please treat each other with respect. We do not tolerate any harassment, discrimination, or any other offensive or inappropriate behavior. If you experience any problems, please immediately contact me and/or our executive director directly. A little bit more about AAJ Fest. We have more than 1,300 attendees registered to join us throughout this week. We're proud to offer more than 100 career-focused sessions and lots of one-on-one meetings for recruiters and potential candidates. If you missed the orientation session earlier today, then you can check out the recording to find out how to set up those meetings with recruiters. In fact, all of our sessions will be recorded except for a few that are marked off the record, so you can enjoy them on demand all week. Also, we have an amazing virtual swag bag full of exclusive discounts available only during the week of AAJ Fest, so make sure to check that out. I'm so grateful for all of our supporters and partners. We could not have AAJ Fest without their support. Thanks to our sponsors, partners, donors, and funders, AAJA is financially stable and strong despite this pandemic and this economy. Thank you especially to NBC Universal, our presenting media sponsor, for your commitment to AAJA. Thank you to the Chan Zuckerberg Initiative, our non-media presenting sponsor this year. And thank you to the Knight Foundation, Ford Foundation, the Democracy Fund, for your unending support for AAJA, our mission, and our programs. AAJA Fest is a brand new event for all of us, and it's been a huge undertaking. But I'm so humbled and grateful for our national staff and the super volunteers who made AAJ Fest possible. Thank you to our Executive Director, Naomi Takuyan Underwood, who is leading us through this pandemic with grace and a lot of patience. Thank you to our awesome national staff, the Convention Programming Committee, the National Board of Directors, the Advisory Board, and all of our chapter and affinity group leaders for all of your leadership and your teamwork. I look forward to reconnecting with all of you this week. Please say hi in the virtual hallway and DM me on Pathable, Twitter, and on Instagram. I want to take socially distanced selfies with you and have virtual coffee, so please reach out. And now, I'm thrilled to introduce our opening speaker, Dr. Sanjay Gupta, CNN's chief medical correspondent, and Naila Budu, host of Axios Today and a longtime AAJ leader. Please give them a warm digital welcome.
Thank you so much, Michelle. This is so exciting. Sanjay, thank you so much for being here with us as well, taking time out of your really busy schedule. So I wanted to just get straight into it. And I thought I would start by just asking you how you're doing. You were just telling us before we went on air in our virtual green room that you have surgery tomorrow. You still see patients. I feel like you're on the air all the time. How are you?
Thank you for asking. I mean, I'm doing fine. It's a strange time, I think, for everybody. It's been very busy. I guess that goes without saying, but I feel like the mind is fully activated right now, if that makes any sense. For all of us journalists probably who have a little bit of ADD, the idea of being able to really focus on something and continuously try to solve this puzzle is in some ways, a remarkable opportunity. The mind just works in a different way, but it's tiring. The kids are home. We have plenty of food. We got a roof over our heads. We get to be with each other a lot, so we're trying to be really grateful for that time. At the same time, recognizing that there's a significant problem out there in the country, and it's worrisome, and there's things that need to be done to change its trajectory. So a lot going on in the mind, but I'm physically doing great. I exercise. I'm taking care of myself, eating well, not getting enough sleep.
That's good.
But
all the basics.
The other stuff.
Yeah. No.
Yes.
So I wonder about you when you think about your identity, because your schedule is pretty much 50-50, right? Being a physician and seeing patients and doing surgery and the journalism. Do you consider yourself sort of like the identity also like half and half, or physician first, journalist first?
Yeah, it's a really good question. I mean, so I've been doing this sort of blended thing now for 19 years. It'll be 20 years next year. But I still very much think of myself as a physician first. I think, there's lots of reasons for that. I think partly, I started, thinking about being a doctor at a very young age, and that's just always been who I've been. And it was kind of my first love. Even when I started doing journalism, it was more talking about health policy issues. So medicine, health, public health, that was always sort of the common denominator. So yeah, very much I think still a doctor first, although I do spend a lot of time now doing this other part of my career, as my wife calls it. And I enjoy that as well.
So in this other part of your career, I was watching an interview you did with Dr. Fauci recently, and you were asking about testing. And you were using yourself as an example of being in an operating room and all the tests you were able to get before you did brain surgery. And I wonder, you kind of expressed some frustration to him, it seemed like, in terms of all of the things that you could get right there on the operating table, but you couldn't get a COVID test. And I wonder, as a scientist, how frustrated you are with sort of the pace of what we have learned about the virus.
Well, it's a really interesting point. I mean, because there's some areas where we have learned a lot, made a lot of progress, and the pace of innovation has been remarkable. Especially when it comes to things like all the vaccine research, for example. That's moving it along at a very fast clip, and some of the therapeutics. I've been really mystified in a way about testing because, we still don't do enough testing. And when we start testing, I think I have a problem, I'm going to the doctor to get tested to see if, what's causing this problem. That is how COVID is being treated now primarily as well. It's for symptomatic people. But we've known, since mid-February that this virus spreads asymptomatically. So people could carry the virus and unintentionally spread other people, which meant that testing was always, since mid-February, going to be critical because people wouldn't know if they have it or not. So, I think the frustration that I was sharing with Dr. Fauci was twofold. One is that, it's been 5 months, 6 months. Why haven't we had the breakthroughs in testing that we could have had, that other countries have had? Why is that still not available here? And two is sort of the ripple effect of this. So you can't test a patient for coronavirus, for COVID. I'm doing brain surgery on them, but that also involves putting a breathing tube into their lungs. Virus may get put into the air as a result. And all these people, the anesthesiologist, the nurse, circulating nurse, surgical team, we're all potentially at increased risk as a result of that. And we have to wear then N95 masks then doing this operation. There's not enough of those. And so, it puts these strains on the system that, have these incredible ripple effects. And frankly, I think he sort of shares that frustration. Why we haven't invested in testing the way that, we were building a plane a day during World War I. Why haven't we been able to create a test in this country that would give us the assurance we could go back to our lives? Kids can go back to school. People can go back to work. We still don't have it.
Mm-hmm. I wanted to play a clip actually from that same conversation that you had with Dr. Fauci. It was at Harvard. And here he is answering a question about public mistrust of science.
That's a very good question, Sanjay, and a very good comment. Yes, there is a degree of anti-science feeling in this country. And I think it is not just related to science, it's almost related to authority and a mistrust in authority that spills over, because in some respects, scientists, because they're trying to present data, may be looked upon as being authoritative figure. And the pushing back on authority is pushing back on government, is the same as pushing back on science. Unfortunately, that's not what scientists are. And I think we need to be more transparent and reaching out to people and engaging society and understanding why science and evidence-based policy is so important.
And I wanted to play that because I feel like that gets to a really big problem in this country in terms of trust, right? And so we know that people have very little trust in the media. People have very little trust, it seems like, in scientists in some ways. And so you are someone who is trusted. And I wonder how you think about that. If people maybe turn to you, maybe people would trust you more than they would trust a government source.
Yeah, maybe they would. I don't know if it's institutionally dependent or not, but I can tell you that there has been a mistrust of science for some time. I mean, we're seeing it clearly with COVID, but I think there's lots of issues that we deal with that have these collisions. Vaccines and autism, for example, climate change. There's all these things that have had these real flashpoints between scientists and whatever other sort of entity it might be. So that's not new necessarily. And, for Dr. Fauci, it's something he's been dealing with for 40 years. I think the urgency of this situation is different. People need to trust, and they need to trust now because real-time decisions are getting made about this. It isn't something that's sort of off in the future that we have time to sort of iterate on. We have to do some of these things now. But the other part of it, I think, to your point, is that I think, and Dr. Fauci mentioned this, the idea that it seems authoritarian. And I do think that that's a real problem, that sometimes scientists can be very didactic in how they present information, top down. And, I remember watching this talk some time ago where it was sort of, you have to explain the what, but also the how. So if I'm telling you what to do about something, also explaining how it works, why it would be beneficial to you, not just that you do it. And I think that involves a humility, because you have to be able to and when you're not totally certain about something, you have to be honest and transparent about that as well. People expect science, medical science, public health science to be like math. I said this the other day, 2 + 2 = 4. Real science is messier than that. You have hypotheses, you test these hypotheses, you prove them out, you develop greater and greater levels of evidence, then eventually you have conclusions. But it takes a while to get there. In the meantime, what do you do? When you have to act, as you do now, you sort of consider the best evidence out there and you keep moving forward in a way that's safe for people, which is what I think, Fauci was really getting at.
Mm-hmm. By the way, if you want to ask questions, please put them in the chat box and we will get to that as a portion of our conversation with Dr. Sanjay Gupta. Sanjay, I wonder, thinking about that though, like the whole idea of how you're conveying information to people, and you are on lots of different platforms. So you have a podcast, obviously you have the CNN TV broadcast, you do Facebook Live. Are you sort of like a flood the zone? Is that what you're thinking in terms of getting this information out there?
Well, you know how it is sometimes, it's like, hey, do a podcast, hey, do this, and so it's not so strategic necessarily, but I do think the other platforms are important. You sometimes run into the risk, I think, of sort of preaching to the choir, if you will. Various platforms, they're showing up to hear you, watch you, listen to you, because they already have some general sort of agreement with your point of view. Maybe not exactly. Maybe they're curious and they want to learn more, whatever it may be. The people who are completely, when it comes to COVID, for example, who may think it's a hoax or don't need to wear a mask or whatever belief they have, may not be showing up at one platform. So hopefully but they may listen to a podcast or they may be on Facebook, So I think it is helpful to try and reach different audiences, different ages as well. I mean, this is a pandemic that affects everybody, young people. I think for the most part, for several months, that this isn't about me. If they heard anything, they heard this doesn't really affect young people. So to be able to explain how it could and what they should do about it and their obligation on a Facebook Live is really helpful. That skews like a younger demographic, I am told. So, and then we try and do stuff on social media as well, and be simple and clear and transparent in whatever we're saying there. So I think it's just, I guess it's flooding the zone, but not necessarily strategically.
Okay. But you also, I was just thinking in terms of kids, you're a father, you have 3 girls. You also answer children's questions about the virus. How do you feel I wonder how you think about, how did you communicate the virus to your kids originally? How did you talk to them about it?
Yeah, so my kids, I have 3 girls. They're 15, 13, and 11. And, it became sort of a very rapid ascent in terms of our conversations because it was January and they had some sort of trip planned, I think, school trip. And I basically got involved and said, this can't happen, this trip. And that sort of forced the discussion because right away decisions were getting made about this. And, for the most part, they have understood. I mean, their lives have been completely interrupted and disrupted, and birthdays missed, graduations missed, all that sort of stuff, and it's tough. And there's a little bit of, they're kind of funny about it sometimes. I think in part because they see me on television all the time. They think that if I wasn't on TV all the time, this wouldn't be so bad. People wouldn't be as worried about it. Life would get back to normal. So it's my fault, which I guess happens. That's the price you pay for being a dad of 3 teenage girls. But it's I feel for them, I think, in some ways more than maybe they recognize the impact on them. We never went through this. I was born in 1969. The Vietnam War was about to end. The market was relatively stable. There was no wars on the horizon. Climate change should have been being discussed, but it really wasn't. I mean, it was a pretty good childhood. And for them, since they were born, our country's been at 2 wars. There's this constant existential threat of climate change. The economy has been very rocky, and now this pandemic. So I do think about their lives overall in terms of how this will shape them. That's very different than my childhood. I had a pretty good childhood, and it's not that their childhood isn't good, but they've had these sort of significant impacts on their lives at a very young age, more like my grandparents did probably than I did. My grandparents, went through the flu pandemic, went through, wars and things like that. So, and we talk about that as well. But again, they're in the moment. This is just all they know. So they seem to be doing fine, and we talk about it pretty regularly.
How are you juggling the work from home, everybody at home? You were telling me earlier about your TV studio is in the basement. I'm glad you got to get out of the basement for this interview.
Right. No, it's a strange thing because in some ways there's been some real great things. I mean, I love being at home with my kids and my wife, and I don't get to do that under non-COVID circumstances very much. I'm always traveling. Or traveling for long periods of time. So it's tough to have this kind of time. So I've loved that part of it. It is, just a relentless work schedule, but at least I get to be at home with them. And I also sort of recognize that it's important to make the best of this time, to not just look at it as the pandemic time and life stops, so what are the good things that we can enjoy about this time? Work-life balance is always, to me, and I'm 50 years old. I've been doing this for a long time. I think it's a little bit of a misnomer for most people. I think it's a work-life interface in many ways. Even pre-COVID, I let my work life blur into my home life and vice versa, and I talk about my work with my kids and they're interested if I've traveled somewhere interesting. So we've always had that sort of real sharing, porous work life, wall. But now it's even more porous, obviously, because I'm home all the time. And we hate to sort of talk euphemistically about what's happening here because we're very aware of so many people who are suffering. As Michelle was talking about, we're very aware of people who have become physically ill, gotten the infection and become sick. And our family's known people who've died from this infection. So that's always in the back of our minds, in terms of how we're approaching things and being careful and interacting even with each other.
Yeah, I'm so sorry. I'm so sorry for your loss. I feel like, and I should say that for, I mean, I'm sure there are a lot of people who are listening who have lost people because of the pandemic. And to that point, I wanted to ask you about something else in terms of just being an Asian American man. You did a podcast, I think, back in March with your colleague, Kyung Law, who's another AJ member who
Yep.
faced this horrific racism when she was out reporting in the field. And you did a whole podcast about sort of Asian American sentiment, anti-Asian American sentiment. And I wonder, like, how you thought about that, how you talked to your daughters about that. Like, how do you, as a family, think about what's been going on in this country when it comes to hate crimes against Asian Americans?
Yeah, it's a big topic of conversation, and even after we did the thing with Kyung, the podcast with Kyung, my girls listened to it, and we had a conversation about it afterward. Um, it's tough, and I think in one hand we do try and approach it from a place of empathy. I've always tried to teach my girls that empathy is a trait that can be very easily withered away over time. So you've got to keep your empathy strong and think certainly before you speak or act or react, as the case may be, if something like that happens. But to also understand that this will happen, to not be naive about the world. I went through a period of time. My parents are both automotive engineers, and so I grew up in small town Michigan, very, very, and I was the only person of any kind of color in my community. And so you right away became different. You were the different person, and then anything that was negative happening in the world outside the United States was assigned to you. The Iranian hostage crisis happened in '79, and I was 9 or 10 years old. Then I was Iranian, and it was always this sort of xenophobia, really, even more than anything else, fear of others. And things that drive that, obviously none of it is appropriate, none of it should be condoned, but I do try, and that was one of the big sort of things that came away with my girls is, how do you approach it? What do you think? Why is the person saying that? Is there any common ground? And sometimes there's not, and if there's not, you just move away from the situation. If there is, then maybe you try and talk, but always do it with empathy. And so, but it's challenging, I think, and especially now with the president continuing to call this the Chinese virus. I mean, it's really remarkable to me. I mean, it just thrown in there every speech. Wuhan virus. This came from China. The Chinese did this to us. I mean, it's so ridiculous, right? I mean, from a scientific perspective, and everybody, I think most people know that, but obviously there's enough people who it gives enough fuel to that fire that it sort of keeps rekindling it. So we combat it every time we can, by being evidence-based, scientifically oriented, using proper language, all of that. So even going back to the Spanish flu, people call it the Spanish flu. It's actually started in the United States, but it was called that as a point of demeaning a place in the world and assigning them this negative attribute, which is still happening obviously right now.
And I mean, I wonder, to that point, I wonder if you think we talk enough about the mental health aspects of this when it comes to Asian Americans. I'm just thinking about Michelle Obama recently talking on her podcast about the low-grade depression that she feels like she's suffering, not just because of the pandemic, but bearing the weight of racism and being a Black woman in this country. And I wonder if we talk enough about that in the Asian American community, and particularly the weight of all of these microaggressions, hate crimes, the whole list.
I don't think we talk about it enough, and I think there's a few things that are driving that. One is, when it comes to this time period specifically, COVID. I think there is. I mean, it's been a few months, 5-6 months, and I think there's been such an urgency around like defining the disease that even talking about people recovering from the disease, that has felt like a luxury so far. So the idea, as you say, of these microaggressions, these other ripple effects, we talk about in the media, but I don't know that it's talked about as a society nearly enough. I also think in part there is, as no secret, there's still a fair amount of stigma towards those who are dealing with any kind of mental, distress. And we had Michael Phelps on our show the other day because this has become a thing for him as a former Olympian. The amount of depression that he has dealt with, it's obviously different than what we're talking about with Asian Americans. But one of the things he said, that even for him, initially seeking help and and sort of acknowledging that he had this thing that he wanted to get help with and address was very challenging. And I think among Asian Americans, especially children of immigrants, there is still a lot of stigma towards mental illness, and a lot of that stigma exists in the Asian American community. Maybe among a generation that has been older than us, but I trained at that time. Some of these were my mentors, and it's a lot better than it was 20, 25 years ago. But I think there's still a hangover of that, like people who are watching right now, who may be dealing with something and want to go to their parents and say, hey, look, I'm dealing with this. What is the reaction you expect, right? What is the reaction you deserve? And it's different for every family, obviously, but I think it's an ongoing issue.
Do you think it only changes if everyone talks about it?
Yeah, I think so. I mean, I do. There is I'll give you an example. My mom dealt with breast cancer, and this was early 90s, I think. And I remember saying something. We were out somewhere, my mom and I and some other people, and I said something about her having breast cancer. And she sort of shushed me. Said, why are you talking about my breast cancer? And it was this huge event in your life and my life. And, we went through this together, and it's like kind of defines me. She was a little embarrassed by it, I guess. It was that, or it was the tough veneer that you have to put. Especially if you're an immigrant, I think. I'm generalizing. This isn't for everybody, obviously, but I think there's some of that. And I think mental, when it comes to issues of mental illness or mental distress, I think there's still some of that hangover from immigrants. We need to put on the tough veneer, not show weakness, give people another thing to criticize.
Sanjay, it's interesting that you say that, because I'm actually a breast cancer survivor. And I feel like when I was sick, that you kind of learn in a crisis, like I learned a little bit more about how to take care of myself. Like things like you have to eat, you have to sleep, like sort of kind of go back to the basics. And I wanted to just, before we get to audience questions, I wanted to ask you a little bit about that, how we can better take care of ourselves now. Like, is it really as simple as like proper sleep, eating, like, how are you coping with all of this?
I probably am doing, besides the sleep part, because I wake up every day at 4:30 in the morning, and I go to bed around 11:30 every night. So it's about 5.5 hours of sleep. So that is not good. I do not advocate that. I'm always a little tired, and my voice gets really raspy. But other than that, I think the basics really do apply when it comes to staying healthy, and it's important. Obviously, you want to have your immune system be as robust as it can be. I think that beyond the obvious things of diet and exercise, and I would say that diet overall, I would place very much at the top of the list. Exercise is important, but diet, in term, all of our calories that we take in are accumulated through what we eat. Only about 20-30% of what we burn is through exercise. So my point is that in terms of the ratio, input is a lot more important. And I think the added sugars, if I had to point to one thing, is if you can just start knocking that down in your diet and just really think about it, it makes a whole range of things possible. Your cholesterol drops, your energy is a lot higher, all that sort of stuff. I did a piece for 60 Minutes years ago called The Toxic Truth. It was all about sugar, and I learned a ton getting to do that piece about how the body cannot metabolize the amount of sugar that we take in. So eating right, exercising, obviously getting enough sleep. My wife recently took a yoga training class, and so I try and do yoga with her. I think really, like I mentioned to you earlier, my mind is just so activated on this, and that's good. I mean, I really enjoy being able to really focus on something, but we need the ups and downs, and so being able to meditate for a while and just take my mind out of it, I think is really good. It's like we need stress in our lives. Everyone says, I want a stress-free life. That's impossible. You would never get out of bed. You would never do anything. What you want is a life that is free of relentless stress. We live in these lives now because of all the inputs that we have through social media, through screens, through everything coming at us to never get a break from the stress. So you need to find like true periods, genuine, authentic periods where you're not stressed, and then you can go back into the mode. So I think those are the four things I'd probably say. Nothing new here, but just worth reinforcing.
Well, but I wonder about that because I mean, relentless stress is sort of like what journalists do. And I can't help but think
Yeah.
of, if we think the past couple of months have been bad, I mean, now we're also going into everything that we've gone through for the past couple of months, as well as a full-blown presidential campaign that many of us are going to be covering very closely. And there's a huge amount of stress that I think, especially this year, as we think about all of the racial overtones and the other stress. Like, I mean, so much of this convention is talking about being an Asian American journalist during this time. And so I wanted to just, before we go to audience questions, I want to ask you one last thing. I know for the past couple of months, you've been writing sort of like these essays that was basically like a series of essays. If the US was your patient, like what you would tell them.
Right.
And I saw you did an update on the 4th of July that basically was like, the patient is not listening. This is very bad. So I wonder if you could just indulge me and think that the AAJ family is your patient base. Like, what would you tell us about this time?
That's a really good question. I mean, the series of articles was the reason I decided to write that was to sort of try and embody, animate in some ways this disease, because it's formless. It's basically invisible to people. It's been really hard to, in some ways, create an identity around it. And the body of the country being the body, you sort of have a localized disease. You can treat it more easily if it's localized. You treat it early. As it starts to spread, it becomes harder and harder to treat. Still treatable, but it's going to require more aggressive treatments. You've got to, you're always told if you get antibiotics, you got to do it for the full, 10-day course. Can't stop halfway. Same thing here. Can't take your foot off the brake, as we did in many states reopening. I think, when it comes to the Asian American Journal Association, it's I think that's it's a real privilege, I think, right, to also be a reporter at this time and to be able to talk about these issues and to recognize that you're influencing generations to come. Not only is the work important for what it is, educating the populace, but I think also important for what it represents. And that doesn't make it easier, I know, if there's some of the things that you were talking about, you're hearing negative feedback or comments, or you're worried about even your job. But I do think the idea of I love being a journalist, and I think it has such purpose to what it is. And there's not a lot of jobs like that in the world. So hopefully it makes it easier to be reminded of that at the time. Also, make sure to take care of yourself, surround yourself with people who love you and support you and as much as you can. But I think our own internal compass should always be pointed in the right direction. And so if you do good work, you do important work, it lives on, not for what it is now, but for what it represents later as well.
Thank you, Sanjay. Thank you so much for that. We've got a ton of questions, so I want to see if we can get to as many of them as possible. The first one was, we keep hearing about how the pandemic has been disproportionately affecting Black and Hispanic communities. Has there been any data on how this is impacting AAPI communities? Do we know how the infection rate and death rate within the AAPI community compares to other groups?
Yeah, it's a great question, and the data has been really hard to come by, and it's been a bone of contention for us because we're trying to get demographic breakdown data, and even getting information. The data on Black and Brown America came from city data first, and then we started extrapolating to states and to the country. So the first question, it's really interesting because in some ways, the obvious reasons it affects certain populations is because of the things you'd expect: lack of access to health care, poor socioeconomic conditions that perhaps made people develop vulnerabilities, pre-existing conditions that are more common in certain populations. But also, I think when it comes to this particular pandemic, what is really important to not ignore is that over the last 5 months, the country has obviously slowed down a lot. People were at home mostly for a couple of months, and even as they start to go out and about, the people that kept the country running in so many ways is Black and Brown America, delivering the food, delivering services, doing all that sort of stuff, making themselves vulnerable, putting themselves into situations that were higher risk. And so I think that that's a big part of it as well in terms of why the racial breakdown has happened. We see an unmasking of long-standing structural inequalities. There's no question about that. This just sort of takes the Band-Aid off of that. But I think the idea that people are doing vulnerable jobs is a real part of this as well. But we don't really have demographic breakdown. I haven't seen good demographic breakdown, certainly from the CDC, on Asian American Pacific Islanders specifically. You know, we have occasionally we'll get case reports from cities and things like that, but not an obvious difference in vulnerability that we can see right now. But you know, we're 6 months into this, 5.5 months into this, so that data is going to be coming in over the next couple of years still.
Another question we got was, what are the kind of stories about the pandemic in healthcare that you really want to see AAJ journalists do more of at the local level?
You know, this is a really it's a tough story to report, I think, because again, for many people, this is just an invisible thing. So you I think have to animate it in some way. You have to make it real. I think that the types of stories that people do, I think, you know, there's tons of editorial directions you can go with this story. You know, people talk about the best ways to prevent the virus from moving person to person, the therapeutics and vaccines, the impacts, as you were asking, on certain communities, how life is going to change as a result, kids' schools, you know, all this sort of stuff. But I think the question I always ask myself whenever I'm doing a story is, you know, what is your objective with the story? What is your real objective? Of course, there's a news value. We are reporters, after all. That we want to educate people and add, I would say, not even give them information, but give them knowledge about this. So that you have to obviously define. But I think, are you inspiring people through fear, or are you inspiring people through what is possible? And I think that's a metric. It's not so much telling you what kind of story to cover, but I think in terms of how you cover it. And I have found, you know, as we said at the beginning, the not just the what, but the how. You know, we're all explainers now. We all have to be amateur epidemiologists. We should know the material really well if we're reporting on it, and be able to explain something. So I tell you a fact, and then I allow myself another couple sentences within the piece to explain why I just said that. So if you're watching at home, you don't go, well, okay, so you said that, but I don't quite get it, you know. And so doing fewer things better within pieces, I think, is important right now. If you have 2-minute piece that's airing on the evening news, can you get across 3 points maximum and make sure you explain those points really well as part of this news story? I think that's that. I think we have to continue to remind people that it's real, however we do that, because we are still in an upward trajectory in this country, and the numbers are likely to get worse in the fall. So, I mean, not sort of letting up on that, but always explaining the how and the why.
Yeah, and that was another question we actually got, how you can convince people that COVID is real. And I feel like this is something you probably struggle with on a daily basis in terms of people encountering people like this.
Yeah, it's a really tough one. And there's also, you know, a large percentage of the country who believe it is real, but it's not really going to affect me, or if it does, I'll be fine. You know, so it's a and that's almost a tougher sort of thing. You know, I'll just power through this. They don't necessarily recognize themselves as potentially contributing to the problem of spread, worsening the pandemic, whatever. So I think that it's challenging. And again, this gets back at this point where I work in a hospital. I take care of patients who've had COVID. I've had, as I mentioned, people that I've known who've died of COVID. Do you constantly remind people of that? Or do you talk about the fact that other countries around the world whose epidemic started around the same time as ours are in enviably better positions than we are? So be inspired by that. Don't see that as a threat as much as what is possible. It's tough. I mean, you know, on CNN, we've made this decision to constantly show what is happening in the United States on the right side of the screen. It's up there. You see what's happening in the world. You see how many people have been infected cumulatively and how many people have died. You see that in the United States. And it's always there as a reminder to people that this is, you know, significant. You know, by the end of the year, this is likely to be the third leading cause of death in the United States, something that wasn't even there a year earlier. So I think we have to constantly remind people of that, but then inspire them through what is possible, simple actions. If we wore a mask, physically distanced, avoided large indoor gatherings, and washed our hands off in 3 to 4 weeks, we'd be on the other side of this curve. That's a pretty inspiring thing, I think. That's not even a lockdown. That is just basic things that are well within our control, and significant percentage of the country is doing. But if 90% of the country did that, or 95% of the country, we'd be looking at this thing in the rearview mirror. The fact that we just can't still get to that point, anything journalists can do to help, obviously, from a journalistic perspective, news-based perspective, I think is really helpful.
So do you feel, it almost feels like it's almost like you're not engaging necessarily in a factual argument with people. You feel like it has to be an emotional one as well.
It's a balance, I think, for sure. I think I think factual still is the tip of the spear. So, for example, all right, just take masks, for example. I'm unmasked, you're unmasked, we're within 6 feet of each other, and we're having a conversation. What is the likelihood I would transmit the virus to you if I had it? And there's an answer to that, right? So if I say the chance of that happening is around 17, 18%, it's not inevitable, but it's pretty high as well. You probably wouldn't want to take a nearly 1 in 5 chance of getting infected. Excuse me. But if I told you that you wore a mask and that likelihood went down to 3%, what would that, that's a 6-fold difference overall just by wearing a mask. So I try and remind people of those sorts of things factually, and then tell the stories of people as well. The stories are what people remember, obviously, and that's what a lot of our pieces are on the podcast, on television, on our digital platforms. But I think the facts do need to lead the way. You want to explain the how and the why and the what.
It looks like we have time for 2 more questions. This is a question for Dr. Gupta about the CNN COVID-19 Kids Special. Where did the idea come from? Why did you and CNN take on this role to educate and report kids? How did the special come together? Was Sesame Street always a part of the conversation?
Yeah, that's a really good question. For me, as maybe a lot of reporters will relate to that are watching, I get an email saying, "Hey, you want to do a thing with Sesame Street?" And I'm like, yeah, that sounds great. I have kids. Maybe they will actually watch something I do now because it's on Sesame Street. And I love kids, and I think it's there was 2 things about it that really appealed to me. One is that Sesame Street does such a good job that the way that they message things it's really a beautiful thing to watch. And it seems so simple if you watch one of the shows, but the amount of thought that goes into word choice and presentation, even colors, and how do you deal with sensitive topics and all that, I think it's really just quite brilliant. The other part of it is that kids ask really honest questions. Kids are very authentic in this regard, and I think kids have been frightened by what's happening right now. They don't quite know how to process this. They don't know what it means. They don't know, is this the way life's going to be from now on out, or what? So you have these conversations. I remember this one situation where people were saying, we're getting less nonverbal cues because people are wearing masks. So young kids who are very young, are mostly at home, but if they go out in public, they see everybody in masks, so they can't read visual cues. I just find all of that super fascinating. But any opportunity I get to talk to kids, I love, because I think it's such a formative time in their lives. And if you can really reinforce positive messages and the what and the why, again, the how of how this is all happening and what's happening, I think makes a huge difference for them.
You must worry about kids now and how they're sort of coping with everything. I mean, the schools question is a big one. I'm not going to try to have you answer that, but I guess I wonder, how much do you worry about sort of what the pandemic's long-term effects on our children will be?
I'm not a huge worrier, and I think that this is what I would say is I think this is just going to be a different chapter in their lives. I have some worry about the very procedural things like graduations and birthday parties and spending time with friends, which, when you're a young kid like that, that is how you grow, I think, and learn and all of that. But I think that they will come out of this in some ways better and stronger. I think they will have had this experience that will shape them. There's these traumatic experiences that our kids always go through, obviously some much more traumatic than others. And for some kids, it ends up being crushing. It just crushes them. And for some kids, it makes them more resilient. It's more like, you work out your muscles and your muscles get stronger. And I've always wondered, I think in part because of my love for the brain, why is that? And it's not just kids, but adults as well. Why are some people crushed by the sort of the amount of daily microaggressions, as you mentioned? Why are some people in some ways strengthened by it, made more resilient? And I think it's the environment, that you are in when these things happen to you. So, being able to be honest with your kids, be transparent, but also to wrap them in a cocoon of love and support and empathy and all that as they're going through this, I think is much more likely to make them resilient as a result of this whole experience, as opposed to crushed by it. So, I worry like any other parent does, but we're just trying to provide a lot of that love and support, let them know it's going to be okay, and hopefully they come out the other side of this stronger and better.
Well, I love ending on that, because as we think about not just parents and kids, but our AAJ family and everything that we will have together for this week, even if it's virtually, we can think about that cocoon of support that's going to be with us for the week as we attend to all of these things. Dr. Sanjay Gupta is the chief medical correspondent for CNN. Thank you so much for taking the time to be with us. I really appreciate it.
No, it's my pleasure. It was a real honor to be here. Good luck. And stay in touch.
Thank you. Take care.